Ever wondered what's really happening inside your lungs during an asthma attack? Let's break it down in simple terms. Asthma is a long-term condition that affects the airways in your lungs, which are basically the tubes that carry air in and out. Imagine these breathing tubes normally being wide and open. But with asthma, three things can happen. They become narrowed, swollen, and sometimes filled with sticky mucus. When this happens, it gets much harder for air to pass through, and that's why breathing can feel so difficult. It's like trying to breathe through a really thin straw. So, what causes this to happen? We call them triggers, and they can be different for everyone. Common triggers include things like dust, smoke, or even strong perfumes. For some, it might be cold air or getting a chest infection like a cold or the flu. Even physical activity, pollen, pet hair, or feeling stressed can set off symptoms. The key is figuring out what your personal triggers are. When asthma symptoms act up, you might experience a few classic signs. Wheezing, which is that whistling sound you hear when you breathe, is a common one. You might also feel short of breath, like you just can't get enough air. A tight feeling in your chest or a persistent cough, especially at night or early in the morning, are also telltale symptoms. These can range from being just a mild annoyance to something much more serious. Sometimes these symptoms can escalate into what's called an asthma attack. This is when the airways suddenly become very narrow and swollen, making it extremely hard to breathe. It's a serious situation that needs quick treatment. If you or someone else is having a hard time speaking in full sentences, breathing very fast, or their lips or face look bluish, it's an emergency. If their usual reliever inhaler isn't helping, you need to get medical help right away. The good news is, while there's no cure for asthma, it can be controlled very effectively. Treatment usually involves two types of inhalers. First, there's the reliever inhaler, often blue, which you use when you have symptoms to quickly open up your airways. Then there's the preventer inhaler, which you use every day. This one works behind the scenes to reduce the swelling and inflammation in your lungs, preventing attacks from happening in the first place. With the right management plan, most people with asthma can live completely normal, active lives. It's all about working with your doctor. You can't always prevent getting asthma, but you can definitely prevent attacks. The best ways are to avoid your known triggers, use your inhalers exactly as prescribed. Keep your home clean and smoke-free and have regular checkups. By staying on top of it, you're in control, not the asthma. Thanks for watching. If you found this helpful, give it a like and subscribe for more health explainers. See you next time.